I'm Dr. Mike Farku, and I'm the founder of WNICER, along with all my colleagues internationally who've come together over the last 20 years to work collaboratively in clinical trials. And in December of 2018, we established the Worldwide Network for Innovation in Clinical Education and Research to help us formally organize in a structure that will allow us to provide grants and support to young investigators. I think our mission is to bring multiple constituencies together to address chronic disease. And we've been doing that successfully here at University of Toronto for a long time. In fact, I think at University of Toronto, we really have shown the way of how folks can work in an interdisciplinary way. The vision, I think, is that we work collaboratively and across disciplines. Right now, we're very siloed in the way we think, even within disciplines. And the idea now is that we have super specialized to the point where we have to come back full circle now and bring people together, because the problems are complex and people are surviving into their 70s and 80s where they have chronic disease. We were really a think tank until we realized that we had to formally organize ourselves. And I want to really acknowledge John Brooks III. And John has been an instrumental leader for us, helping us to understand the landscape of working across multiple sectors and for building relationships with industry and with academia. Initially, we started WNICER because we wanted to support research in cardiovascular medicine at University of Toronto. But what happened in the evolution of this process is we've formed great partnerships with some of the leading institutions in the world that are similar to the University of Toronto, like the Mayo Clinic, the University of São Paulo, the University of Melbourne in Australia, and other institutions that allowed us to bring 10 major hubs together to form the Worldwide Network. By working with Cura, we've had the ability to also intersect with many other sectors within the US and worldwide to develop relationships that allow us to be more impactful. We're excited about WNICER on two fronts. One is to tackle the interrelationship of chronic diseases. We see that many of the risk factors are common for diabetes, heart disease, cancer, and neurodegenerative diseases like Alzheimer's. But what happens when patients have an event, which is most of the time when they encounter the healthcare system, is they're actually at risk for other diseases. And that's one of the emphasis that we have at WNICER, both primary prevention and secondary prevention.
WNICER's goal is to gain a better understanding of the interrelationship amongst chronic disease. I'm a headache neurologist, and my area of expertise is migraine. We know that there are more than 1 billion people on the planet with migraine. And the World Health Organization recently determined that migraine is the second leading cause of disability worldwide. And one of the most potent risk factors for adult onset chronic disease is adverse childhood experience. Adverse childhood experience, or ACE, is a potent risk factor for adult onset chronic disease. And toxic stress has an impact on the body and on the brain. It promotes an inflammatory cascade, which we think leads to chronic disease. And we know that migraineurs are at an increased risk of developing other chronic diseases. Why, if you have one chronic disease, are you at an increased risk of developing a second chronic disease? And WNICER is planning to put research and innovation into understanding common pathophysiology, looking at innovative therapies, but most importantly, to understand common risk factors.
The other thing that excites us, obviously, is education, educating the future, because there's a huge challenge for young investigators now with reduced funding, lack of integration, and lack of inspiration, really, to see a career devoting the next 50 years to research. It's challenging. And so we are really invested in young clinician scientists and supporting them in their training and in the first 5 years of their career. So at WNICER, we have a big educational program, really, I think, in two parts. One is to get the leading scientists together to educate each other. Probably most important is to educate clinicians. So as we make discoveries and we find new drugs and new devices, it takes time for that to penetrate into the clinical market. It takes up to 10 years. And so we have a very robust clinician educator program, and it's been incredibly successful. And these educational grants are without any relationship with industry, but rather allow us to go out and reach out to the community. So we can generate new evidence, we can educate people, but we have to work with governments and health policy folks to make sure that these therapies that we develop are approved and provided to as many people as possible. We have relationships with government to make sure that the work that we do not only is funded by government, but goes back to them to understand how we can improve health by working with agencies on health policy. I think that's very important as well. WNICER is an organization that works globally and collaboratively across academia, industry, and government to tackle the most important chronic diseases of our time.
Worldwide, there is a need to understand the interrelationship of chronic disease.
We need healthcare that is individualized and universally available.
Understands the full person and is responsive to their needs.
Healthcare that solves the problems patients feel are really important to them.
I want to do research that impacts patients' lives, changes their disease course, and reduces their burden of illness.
I want to know why most people get better and stronger and faster when they exercise, but some people don't.
Our strength lies in collaboration and diversity.
Let's make innovations in the prevention of chronic disease.
We need your support.
We
absolutely need your support to make this happen.
To make a difference.
To make a difference in healthcare.
To make a difference.
To make a difference in people's lives.